Although racial disparities in the health place isn't talked about that much, it is one of the most common disparities present in America. Whether it be black people have less representation in the medical community, or if systematic racism is present in hospitals, racial disparities are a huge problem. The major factor of disparities that we're going to discuss today in this podcast is education. Whether it be educating the general black public or future doctors, we need to change the way we educate to stop these racial disparities. So currently, many medical students learn implicit messages from their doctors that color their perceptions and contribute to biased decisions in the clinical setting. So basically, doctors that students shadow or work with will label specific people with certain words such as difficult patient or doesn't listen to directions and poor literacy skills. After continued exposure to these messages, the students begin to unconsciously think the same way, altering certain words to certain patients. An extreme example of this will be in the novel Brave New World. In the novel, children are born into classes alpha, beta, gamma, delta, and epsilon, with alphas being bred to lead and epsilons bred to be workers and followers. Although the alpha children are first born pure and indiscriminatory, they are constantly exposed to discrimination towards the epsilons. Eventually, the alpha children grow adapted to that discrimination and start acting discriminatory to the epsilons. By talking about the hidden curriculum here, we can show awareness to the medical students. If the students realize what's happening, they will be less influenced by these implicit messages. Educating the black population is another way to reduce racial disparities in the hospital. One example of this would be the disease HPV. So generally, black women not only have a higher rate of getting it, but also a higher rate of getting cancer from it. It's the easiest and most effective way to prevent HPV would be the HPV vaccine, which also prevents many of the cancers that come from the disease. However, many black women do not take the vaccine due to a lack of knowledge about HPV and the vaccine, or mistrust in the vaccine, or fear of the long-term side effects. This is because the black population is not as educated as the other races about the vaccine. In a research by Lee et al., we found that only 51% of the black population knew about the vaccine, while 15% more white people knew about it. One reason for this would be the underrepresentation of black doctors in the medical community. If there were more efforts by the medical community to help educate the black community about this vaccine and dispel any negative rumors about it, many fewer black women would get affected or die from the HPV virus. So does anyone have any questions?
So what is the hidden curriculum present in hospitals?
So basically, it's a passive way medical students are taught racism in the health place. So when the students go shadow a doctor or work closely with them, they'll unconsciously pick up how the doctor treats different patients differently. Basically, will influence the student to have biased decisions against certain types of patients. This also contributes to the race-based medicine theory, which is a belief that the race is a biological variable that can affect treatment. One popular belief is that black people are less sensitive to pain, which leads to undertreatment or no treatment at all. So basically, a lot more symptoms for black people to get the same treatment as white people do. So basically, a lot more black people will die from diseases that white people easily survive from, because doctors don't give enough, or they're going to be late on giving the treatment.
Why do you think education can solve racism in the health place?
So a quote from the leader Malcolm X, it said, "Education is a passport to the future, for tomorrow belongs to those who prepare for it today." So basically, it means that right now only 6% of the doctors in the U.S. are black. So they're heavily underrepresented right now in the medical community. So that means the black community doesn't have enough of a voice as the white community, like other communities, since they're so underrepresented. So, if there were more black doctors, it would help disprove the race-based medicine beliefs and also weaken the hidden curriculum that I mentioned before. So a lot of the doctors who are practicing discriminatory actions, they're basically not doing it because they're racist. They're mostly doing it because that's what they learned from when they were students, when they were shadowing doctors. So the hidden curriculum is kind of like a cycle. So a student will learn it from a doctor, and then the student will become a doctor and teach it to other students. And having more black doctors will point out that what they're practicing is racist and help disprove the hidden curriculum, which will be a huge step in promoting equity.
Wow.
Currently, we can only educate the public about these racial disparities in the health place, propose potential solutions. Hopefully, we can spread awareness to medical communities about the hidden curriculum and educate the public. So this concludes our final episode of the Teen Titans podcast. Thank you.